Hello and welcome to the channel. This is Dr. Prashant Shukla, and today I have come up with yet another interesting case in which I am going to demonstrate how to give a posterior septum block. And this is a 50 years old female patient who presented to us with a diminution of vision in her left eye for 6 months. On examination, she was having soft cortical cataract. So here I am going to demonstrate a technique which is very useful in soft cataracts, the pre-chopping technique. So we are going to pre-chop the nucleus prior to phacoemulsification, and let's begin the surgery. So using an MVR blade, I am going to make side ports, and now is the time to stain the anterior capsule. Although I have got a very good red glow considering the excellent stereocoaxial illumination given by the Lumira eye microscope, still it's a good idea to stain the capsule with trypan blue, because in cortical cataracts many a times it's very difficult to visualize the capsular axis. The anterior chamber is now being filled up with viscoelastic, and I'm going to initiate the capsular axis. So some HPMC is just layered over the cornea to aid in visualization, and I am using a 26 gauge band needle cystitome to raise a C flap, just as shown, and I am going to do the rhexis very slowly for easy understanding and demonstration purposes. Well, this surgery is meant for education purposes, and VO discretion is advised in these cases. Now I am going to use a micro rhexis forceps to make the capsular axis. In these cases where we have got dense cortical opacity, spoke-like opacities, there are always chances that the visualization of the rhexis becomes difficult. So one has to be very careful. Here I am using the stereocoaxial illumination of the microscope to aid in the red glow. I am aiming for about 5.5 millimeters capsular axis. Also, I have my plans of just trying to tilt the nucleus out of the capsular bag by hydrodissection. If I achieve that, I won't be doing pre-chopping. So the rhexis has been complete, and now is the time to make the main port. I am using my 2.8 keratome to make a triplanar incision. This is a posterior limbal incision, and that is why I have used a crescent to just cut the conjunctiva to avoid ballooning. One more side port has been made. Well, hydrodissection is one of the most crucial steps in these kind of cases, because it is seen that we have sometimes we have very dense corticocapsular adhesions, and for a safe procedure of cataract surgery, these corticocapsular adhesions need to be freed up. So I am doing multiple small bits of hydrodissection, and now the hydrodissection has been completed. We have checked the mobility of the nucleus. This is an edited video, and now is the time I am going to use the pre-chopper. The pre-chopping set consists of two instruments. One is the sustainer, and other is the pre-chopper. Left hand is the sustainer. The ball tip goes under the capsular axis margin, and when it is turned, it hooks the equator. Then other is the pre-chopper, which is just placed in front of the anterior capsular margin into the substrate of the nucleus, and both the instruments are brought together, and we have a split, and we have got two heminuclei. In this procedure, one has to be very careful that the sustainer goes below the anterocapsular margin, because that is the most important thing, otherwise we can have a zonal dialysis. Here I am taking two Sinski hooks, and one is the sustainer, another is the Sinski, just to separate both the heavy nuclei properly. Although we have got a cut, still there are a few additions here and there. And now I am going to use the Sinski to just take out one piece out of the capsular bag. This can also be said as a D-flip technique. 1D of the nucleus and one heminuclei is taken out in the iris plane, and now it's going to be emulsified using the phaco needle, some viscoelastic to protect the corneal endothelium, and here I am ready with my phaco handpiece. Phaco handpiece goes inside. The vacuum here is about 260, bottle height about 100, and aspiration flow rate is controlled by the machine automatically. The power used here is about 35, and slowly the one heminuclei would be just emulsified. It is a soft cataract, not much of a problem, even if we do in the anterior chamber or at the level of the iris plane, because I am not pressing the pedal too hard and I am not giving too much of the energy, and I am also taking care that the small bits and pieces do not just move around and hit the corneal endothelium. I am just pressing the foot pedal appropriately so that we don't have much of chattering of the nuclear pieces, because that is the thing which causes the damage to the corneal endothelium and subsequent post-operative corneal edema. The second heminucleus is also held, and within few minutes it would be just emulsified. Purposely the video has been shot slowly. In fact, I am doing the surgery at a slow pace, and now the nucleus has been emulsified and time to remove the remaining cortex as well as the epinucleus. Sometimes we are left with small bits of nuclear pieces which can be easily removed using the coaxial handpiece, irrigation and aspiration. And here I am just removing the subincisional cortex first, because I feel that is the most difficult thing to do and we should do it first. I'm trying to remove it, it's not coming that properly. So I have shifted to another place, and we have got a thick sheet of epinucleus and cortex, and I am trying to engage the cortex so that when the cortex comes, the epinucleus also comes along with it. There are few elements of cortical cataract attached to the epinucleus, so it's not that very soft, and it's taking a bit of time to come through the small port of the IA. Here I thought there was some problem with the PC and there was some issues regarding the chamber fluctuation, so I am instilling some HPMC in the capsular bag to assess the situation. After the bag was filled, I found that things were going on smoothly, so I continued with my aspiration of the cortex and the remaining epinucleus. So slowly all the epinucleus and cortex is being removed. Vacuum here I have used is about 350. This epinucleus is a thick sheet and it's taking some time to come through the small port. So I am using another instrument to just figure this thing out through this small opening. And that's it. The last pieces have been removed now. This pre-chopping technique of nucleus division is a very good technique, because in my early days, even till last year, I had problems dealing with soft cataract. Sometimes there was a bowel creation, sometimes there was improper division of the nuclear pieces, because this is a soft nucleus and it takes a bit to remove it. It's difficult to hold. So now is the time to implant the intraocular lens. Single piece, monofocal, spheric, hydrophobic intraocular lens is being implanted into the capsular bag. The one haptic goes into the bag directly, and the other haptic would be just be dialed in a moment. So I was talking about the pre-chopping thing, and pre-chopping is a good technique. We can just have two pieces straight ahead, because many a times the direct chop doesn't work. Even sometimes stop and chop, if we have a thin long trench, even then the nuclear pieces fail to separate, and ultimately we end up having a bowel, and then things become really very difficult. And on the top of it, if we have a small capsular excess, things become even more difficult. So in soft cataracts, we should have at least 5 to 5.5 millimeter of capsular excess, even bigger if we can do it. I feel soft cataracts are tricky, sometimes even difficult than operating on hard nuclei. So many times these cataracts do not come out of the capsular bag on hydration, on hydrodissection. The size of the nucleus is bigger sometimes, considering the size of the capsular excess. So I feel it's a good technique and one should always try. So it's the end of the case. I put in some air bubble, and I'm going to hydrate the side ports and the main port. That's it. The case is done. Thank you so much for watching. Have a nice day. If you like the video, do share the video with your friends. Hope it's going to help you in your learning curve, and give your best, and do like, share and subscribe to my channel for more recent updates. Would be coming up with new updates, and thank you so much and have a nice day.